whatever your decision is, it's your decision, and you shouldn't feel like stigmatized by wearing a mask, or kind of feel like insecure in that decision, because it's not necessarily to protect you, it's to protect others. And when you're out on the street or at a grocery store or some setting where you're interacting with people outside of your household, you don't know, the composition of those households and the, you know, immune status of of the individuals living with that person. So what I've seen a lot of actually is, now that guidance is lifting, there's a lot of kind of like in your face questions, and to the point of actually getting like violent, saying, why are you wearing a mask? You don't have to wear that. And actual physical altercations, and some of them actually being on tribal reservations, where people are coming from off the reservation, to interact with tribal businesses and saying, like, what are you doing? Like, the CDC says this, but looking to stir up controversy. So at the end of the day, it's the Swiss cheese model of protection. Doing one thing is going to be provide its own level of effectiveness, but as you start to add layer after layer with masks and other forms of prevention, that's all the better.
I like that Swiss cheese. Dr. Lowe?
So one of the things, maybe to take it out of the more political areas, that in Asian countries, in Asian cultures, it's a lot more common to wear masks when you're in public, especially in crowded urban settings, as well as kind of the tradition that if you're not feeling well, you would wear a mask simply out of courtesy to your community, your neighbors and friends, so that you're less likely to transmit whatever disease it may be, whether it's flu, whether it's COVID or something like that.